Hello everyone, I am Sarun Jose, Assistant Professor, SNS College of Pharmacy and Health Science, Coimbatore, and today we are going to discuss the topic about drug interaction. First, we can see the definition of what is drug interactions. First, a drug interact with when the effect of one drug is altered by the presence of another substance. So, one drug which can be altered by the another substance. It should be either a drug or a food or a beverages like healthy drinks or the herbal products or the environmental chemical. Anything that alter the drug, any one drug is known as drug interaction. It should be either the two things should be drug, that is two compound should be drug, or one compound should be drug and one compound should be a foods or the herbal products. So, in simple term, when a two or more substance, are taken together and one change the effect of another. So, one drug effect can be changed by the another drug is called a drug interaction. One drug effect can be changed by the another drug is known as drug interactions. Okay. Then why drug interaction is matter? So, why drug interaction is important in pharmacology? So, drug interaction is one of the important topic in the pharmacology. In each and every drug we want to know the drug interaction, then only we are clinically strong in that topic. So, drug interaction is not just a theoretical concept. So, drug interaction is not just a theoretical concept, it is a clinical, real life clinical oriented consequences. So, the drug interaction may be reduce the drug effectiveness, which reduce the therapeutic effect. So, the disease not treated properly. If we take the paracetamol and it can be interact with some other drug, it does not reduce the fever or pain. And next one, increased toxicity. So, which can reproduce the any harmful effect in the body, and adverse drug reaction which leads to hospitalization or the death. For example, if the patient take two drugs in the both depress the breathing, example, a person taking the anti-asthmatic drug and a patient also taking another one antihistamine drugs. So, these two drugs are which produce the bronchoconstriction effect and which reduce the depression, the rate of breathing. So, this combination of effect is very dangerous, which leads to death soon most of the time. So, this type of two anti-depression drug like breathing depression drug and also the depression antihistamine, like example like antihistamines and clonazepam, like hypnotic and sedative drugs are also very dangerous combination. So, the drugs can be produced the drug interaction. So, drug interaction is especially important in elder patients. So, elder patients are easily sensitive to the drug. So, it is important for the elder patient and patient with multiple disease. If the patient with multiple disease, they frequently take the different type of medications. If one patient have asthma and epilepsy and ulcer, so the patient take different type of drugs. So, the drugs are easily interact with each other. So, that type of cases, the drug interaction is very important and it should be thoroughly monitored, clinically monitored. So, patient taking the many medication which is known as polypharmacy. Okay. So, next classification of drug interaction. So, it is majorly classified into two types. One is pharmacokinetic interaction, next one is pharmacodynamic interaction, next one is pharmaceutical interaction. Today we are going to see the pharmacokinetic interaction and pharmacodynamic interactions. So, first one is a pharmacokinetic interactions. This interaction affects how body handles the drug. This is in pharmacokinetic interaction we study how the body handles the drugs. They involve the process of absorption, distribution, metabolism and excretion. So, this is often summarized as the ADME property. So, absorption indicates how the drug is absorbed, and distribution indicates how the drug is distributed to the different part of the body, and metabolism how the drug is converted into one chemical particle into another chemical particle for the distribution or an excretion. And next one, the excretion topics. Okay. So, first one, absorption interaction. This occurs when the one drug affects the absorption of the another drug from the gastrointestinal drug. When we take the two different type of drugs together, one drug can be affect the absorption of the another drug absorption. So, this type of absorption. So, absorption is mostly commonly done in the gastrointestinal tract. So, one drug absorption is prevented by the another drug absorption. So, this is an absorption interaction. Example, the calcium is the reduce the absorption of the certain antibiotics like tetracycline. So when we take the tetracycline and calcium carbonate like calcium together, which can reduce the absorption of the calcium, reduce the absorption of the tetracycline. So most of the drugs are cannot taken together with the calcium, because calcium which bind in the gastrointestinal tract and which prevent the absorption of the tetracycline and more antibiotics, and also it interact reduce the absorption of more related drug. So doctors do not prescribe the calcium drug together. Okay, this is reflected in pharmaceutical incompatibility noted in tablet formulation when calcium salt or binded drug and reduce their bioavailability. So calcium or binded with the drug and reduce their bioavailability. Next one, the distribution interaction. Some drugs are competitive in the binding to the plasma protein. Some drugs are competitively binded to the plasma protein. Example, one drug displaced from the another protein binding site increase the free drug concentration. So one drug displaces the protein binding site. So each cell contains different type of protein binding site. So easily the one drug is two drugs are taken at the same time. Two drugs are binding only one particular binding site, means the two drugs did not have enough space to bind in the cell, because already if we take the paracetamol and aspirin, the paracetamol already bind in the binding protein or the binding site of the cell. So next aspirin tablet do not have a place to the bind in the plasma protein. Okay. Next, metabolism interaction. This is among the most important interaction. So most common and most important interaction, they are involved in the liver enzyme. So the liver enzyme, the metabolism, the important enzyme for the metabolism is an cytochrome P450 system. So cytochrome P450 system is one of the important for the metabolism. So enzyme induction is the decrease the drug effect. Enzyme induction which decrease the drug effect, and the enzyme inhibition which increase the drug effects. Example, one drug inhibition liver enzyme, another one drug accumulate and produce the toxicity. If one drug inhibit the liver enzyme, next another drug does not have space to metabolism, so which leads to accumulation and which produce the toxicity. And next on the excretion interaction, they can be affected the kidney function after elimination. They can be affected the kidney function after elimination. And example, one drug reduce the kidney excretion by another. So one drug reduce the excretion of the another drug in the kidney, which increase the level of the drug in the kidney and which leads to the toxicity. So next topic is a pharmacodynamic interaction. So pharmacodynamic interaction occur when drug affect each other action at the site of effect without changing the concentration. So pharmacodynamic interaction is nothing. This interaction occur when the drug affect each other action the site of effect without changing the concentration. They are classified into three types, majorly additive effect and synergism effect and antagonism effect. So first we see the additive effect. The two drug produce the same effect. If the two drug produce the same effect, it is lead to sum of effect. If the paracetamol and ibuprofen are taken at the same time, which can be produced the similar effect and the same effect. If the paracetamol produce 50% action, the ibuprofen also provide 50% action. So is equal to 100% action. Each drug produce their own therapeutic value. Next, for example, painkiller are taken together increase the pain relief. So this is the example for additive effect. So next one is the synergistic effect. So the combined effect is greater than the sum of individual effect. So when the paracetamol and ibuprofen taken at a different time, to produce the individual drug effect in the different time. But when it is taken together in the same time, which increase the concentration in the double time. For if we take the paracetamol, which produce the 50% therapeutic action, and if we separately take the ibuprofen, which produce the 20% of the therapeutic action. But if we take the paracetamol and the ibuprofen together, already the paracetamol have 50% effect and the ibuprofen have 20% effect. The ibuprofen which induce the paracetamol effect and which produce a 100% therapeutic effect. For example, certain antibiotics is used to enhance the bacterial killing. Example, amoxicillin and potassium clavulate. So amoxicillin is the antibiotics and potassium clavulate which is used to induce the bacterial killing of the amoxicillin. Okay. Next one is the antagonistic effect. One drug reduce or block the effect of another drug. So one drug can be reduce the effect or block the effect of the another drug is known as antagonistic drug. Example, one drug stimulate while other suppress the same function. For example, antihistamine, we are taking the antihistamine for any immunosuppressant activity or the running nose. So it suppress the immune system. At the same time, if we take another some type of drugs, it stimulate the immune response. So one drug action can be blocked by the another drug. So these are the one of the major topic in the drug interaction. There are also have more topic like drug interaction, drug herbal interactions, so drug hormone interaction. So there are different type of interactions are seen in the next classes. Okay, so these are the basic thing about the drug interaction. I hope this video is useful for you. Thank you.